And so, my fellow Americans, ask not what your country can do for you. Ask what you can do for your country. My fellow citizens of the world, ask not what America will do for you, but what together we can do for the freedom of man.
Welcome back to the Freedom First podcast, where we bring on experts and heroes from all walks of life to have in-depth conversations about the most important topics and issues our world is facing. Hello, everyone, and welcome back to another episode of the Freedom First podcast. I'm your host, Blaine Smotherman, and today we have an exciting guest on for you. Today's guest is an expert in the field of neuroregenerative medicine, the treatment of traumatic brain injuries, and is recognized as a top leader worldwide in interventional endocrinology. He's the founder of the Millennium Health Center, and in 2006 and 2007, he participated in an ESPN Outside the Line program where he shared his clinical experience assessing and treating both professional boxers and NFL players who had complications arising out of their sports. He has appeared on several episodes of the Joe Rogan Experience, and most recently appeared on the Joe Rogan podcast with his partner, Andrew Marr, for episode 1589. Ladies and gentlemen, please welcome Dr. Mark Gordon. Hello, everyone. Welcome to the Freedom First podcast. I appreciate you joining and tuning in again. Today, we have on Dr. Mark Gordon. I'm going to let him take it away and kind of explain who he is and what he does so I don't mess it up. Thank you for being on, Doctor.
Thank you very much for having me, Blaine. I'm a physician that started out in the basics of family medicine, found a passion in endocrinology while I was in my residency, which was good because when I got to my late 40s, I started having a lot of problems. Well, the fact that I had 6 traumatic brain injuries throughout my life, starting at 4 years of age, being hit by a car while riding a bicycle, and 3 subsequent auto accidents I didn't cause. Other people liked my car and started running into it all the time. And, martial arts for many years, and you accumulate dings, and the dings culminated into change in personality such that I was on antidepressants and, not doing very well back in the 90s. And the only fortunate thing was I used reading as an escape. So in the process of escaping, I started reading. I was reading a book talking about hormones, and there was reference to brain, and I started looking it up, and boom, there was the suggestion. And the answer was in my going to a laboratory and getting blood tests and finding out I was deficient in 3 hormones. So that set the stage because within 90 days, I was totally different. And then jumping forward to about 2004, I was reading in preparation for a new lecture. I had regained a lot of my cognitive abilities such that I was able to feel comfortable in giving lectures on technical aspects to the brain and hormones, the body and hormones, endocrinology and neuroendocrinology, and found an epiphany article which basically stated there was a relationship between trauma, loss of hormones, and personality change. Not only personality, but cognitive change. So that was my intro into the world, and started working with NFL players back in the late 90s, early 2000. And that just added more fuel. I ended up on ESPN Outside the Line talking about why football players did not heal well. And that's because we know the hormones that are in our body have an influence on how well we heal. And then in 2000, that was 2006, 2007 was with pugilists and NFL players, James Toney, Lights Out Tony. He was having his problems, and we were on ESPN talking about his problems and also adding to the NFL story. And then in 2009, I left the NFL football world because I felt that these skills that I was learning and this protocol that we were developing had a better use. and that better use wasn't in the people who were making millions of dollars a year, but it was for the people who defended us in the military. So in 2009, I dropped the NFL and moved over to doing military. I published an article that went national to recruit either active or veterans, and started in 2009 interacting with veterans and active. My first active was out of Fort Bragg, North Carolina. And then in 2015, early 2015, I was contacted by my associate now, Andrew Marr, who is Green Beret, who you've heard about, everybody's heard about on Joe Rogan, having been on it 3 times with me, and talks about, he was on a multitude of medication. The system wasn't working for him, and it was actually making him worse. He wasn't getting better. And then he and I met in the cloud, and he came up from San Diego where he was under medical care. He lives in Texas, but he was in California getting medical care, and came into the office. We drew the blood, started him on treatment right then and there, and his improvement was within days. He began improving within days. And then he goes on to do things like going to Stanford Ignite program, his clarity of mind. He started in the business area. I don't want to steal, you're going to have him on the show, so I don't want to tell too much about it. But a long story short was that he and his brother Adam, who was also a Army helicopter pilot, Apache attack helicopter pilot, he gave up his commission as captain and ended up helping Andrew establish the Warrior Angel Foundation. And through the Warrior Angel Foundation, I provide my services. We're independent, but the Warrior Angel Foundation and I work together. So anyway, this movie came out, Quiet Explosion, and Joe Rogan was an instrumental part in helping us to deliver our message to a multitude of Special Forces group, regular Army, such that we have quite a large growing number of active and veterans that we've been able to help in getting into our program. Right now, insurance companies and third-party payers, look at what we do as being unnecessary, but it's necessary to get the necessary results. So we've been very effective at that. And then in January of last year, I was invited to England to explain to the Ministry of Defense, the Surgeon General, why their top SAS guys were flying into Los Angeles to get assessed and treated. And the bottom line was they wanted to get better.
Right.
So Andrew and I went to London to present what we presented within a group of 4 or 5 other doctors. And it led to a 4-hour repartee about how, the science doesn't support what we're doing. Well, if you don't read the science that we're reading, your science doesn't support what we're doing.
Right.
It's just different paradigm, different model. And that's why we've been able to do so well with our patients, is because we apply the now cutting edge science that has been already written about for 20 years. Just no one uses it because just continue doing the same old, same old. But our practice is focused on, my side of it is on the military, and my daughter, Allison Gordon, who trained with me for a year and a half to become proficient at what we do, and now been with me almost 4 years, might be a little more. 4 years has taken over the civilian population to allow me to continue with the military and to start little programs, as you heard on Rogan, programs with 3 different segments of the Special Forces group, or the SOCOM group. And their response so far has been nice, much better than where they were before, either on medication or off medication, doing nothing, and then being placed on a protocol. Seems to be working.
So you're working with the SOCOM group?
Well, we work with Green Beret, with SEAL teams, with Marines, with Rangers, a whole bunch of, all the 7th Group, 5th Group, 101st Airborne. We don't play favors. My goal, or Andrew and our goal, is to provide the knowledge of what we're able to do and then to implement it, which is, what we're doing. I'm self-funded, meaning that I work to generate funds so that I can help with this project for our veterans and active military. Andrew, I get through contacts and so forth, and also he's developed some significant contacts. His organization gets donated charitable funds, and that is applied for getting people, veterans and active, or military, we just call military, into our program. So we can try to pay for as much as we possibly can We've got to spread it around because, after Joe Rogan, 680 new people want to come in. And around the country, we've trained a group of doctors at the website, which you've looked at, www.tbihelpnow.org. Under the team, there's a listing of docs that we've trained. I've trained over 600 doctors specifically in our science. Some of them have elected to take the exam, which allows them to be listed on the website.
Awesome. So how effective has it been? And how many people do you have that you've worked with and helped?
In the presentation that I did to the Military Surgeon General in London, I presented 459 individuals, and their average improvement, 78% of them were 50% or better. In the group that were 100% better, there was a Vietnam veteran who had suffered for more than 35 years, and in 10 months, he was 100% better, and his wife, Susan, acknowledged the fact that this patient was doing very well. Our oldest is 80. I think Ben turns 85 this year. Our oldest Vietnam veteran, we have about 16, and the rest are current from Gulf War scenario individuals. We have some people from the Falklands, from England, and from Afghanistan and so forth who have done well. We have about almost 3,000 civilians, 381 military, or 83, and that group of 459 included people who had brain cancer, brain surgery, medication effect, chemotherapy effect, loss of consciousness, no loss of consciousness, automobile accident, assaults, motorcycle accident, bicycle accidents, just the whole grouping.
It's all over the place.
All causes, right. One of the analogies that I use so people can understand that we ignore minor injuries unless we're knocked unconscious. And it turns out that you can have, the analogy I use, 10 dimes, meaning 10 small insults throughout your life, or $1, and they both equal the same.
Right.
So you can have one major trauma with or without loss of consciousness. They found that 85% of the people with knocked unconscious, when you do an MRI or CT scan, which is done initially to make sure you don't have any bleeding in the brain, they had negative findings, but they developed issues of depression, insomnia, migraine, seizures, all these things. And the question is why? And the answer is inflammation. All of these traumas precipitate chemical changes in the brain. And these chemical changes in the brain alter the brain's ability to regulate itself. It's like having a CPU in your computer, and one of the chips that help to control it breaks. So the CPU is trying to do its job, but its ability to transmit out to the periphery or to other parts of the brain are impeded or damaged, so that the signal is garbled. So when you have a garbled signal, you don't have calmness, you have anxiety, you have panic attack, or the hormones or the chemistry that keeps you calm. They talk about serotonin uptake inhibitors, SSRIs, or dopaminergic receptors, or epinephrine, norepinephrine, or whatever the neurotransmitter, acetylcholine. You have disruption in these transmitters, and it causes us to be off balance.
So the inflammation's causing these different disorders and mood disorders?
Correct. And on my website, the one I already stated, the www.tbihelpnow.org, in anticipation of fact-checking, I put together 30 very key articles that are posted on my website under The Science, which is noted for Joe Rogan, for the podcast I did with Joe, because it has these incredible research that's been done for 10, 15 years, talking about the relationship between inflammation and the precipitation or the appearance of illnesses like depression, anxiety, bipolar, obsessive compulsive, Parkinson's, Alzheimer's, ALS, multiple sclerosis. So it's all there. The literature's there, but no one's reading it.
Right. And so, yeah, and I definitely want to link your website in and get people to the website and start reading those things.
Right.
So what can people do, I guess, and what do you guys do to decrease the inflammation, kind of decrease the severity of some of those mood disorders?
Right. The position that I took 8 years ago was that hormones were the key, and I no longer believe that. It's an important part, and that's because when you have trauma, we find these patterns of hormone deficiency. So that's the superficial aspect. The question that I started to ask was, why does that happen? Why does testosterone signaling, called luteinizing hormone, stop working? Why does thyroid stimulating hormone that stimulates the thyroid gland to make thyroid stop working? Why does acetylcholine, ACTH in the brain stop being produced to tell the adrenal glands to make cortisol? What is the problem that causes growth hormone not to be made, which goes to the liver and turns on 9 proteins? So I started looking at that, and it turns out that there's this intricate signaling system, and you can interrupt that signaling system by throwing acid into it. And that acid is inflammation. So it turns out that hormones like testosterone, estrogen, progesterone, pregnenolone, allopregnenolone, DHT have secondary functions. And those secondary functions are to reduce inflammation. So these hormones are called pleiotropic, which means many functions. We've only looked at these hormones as being sex hormones or gender hormones or reproductive hormones. Turns out they have this incredible ability to regulate inflammation. In one of the articles I believe that I posted there, or it's on the greater group of science that I have for our patients, or for anyone really, is that testosterone drops inflammatory cytokines, interleukins, and stimulates one called IL-10, which helps to decrease inflammation. So if you're deficient in testosterone for whatever reason, you lose the ability of the brain to have another means by which it controls the inflammation. Also under stress, I talked about a hormone specifically called chemokine, fractalkine. And I have 2 or 3 articles about fractalkine talking about how it integrates in creating inflammation when it's not being produced. Under stress, chronic stress, no physical damage, no contact sports, no contact explosion, nothing. Just chronic stress, living in a very stressful life environment, watching the news about the elections or the bickering back and forth and all the stuff that's going on has created a lot of stress for our patients where they were doing well, and because of all the stress, the environmental stress, I'll call it, social environmental stress, they started sliding backwards and getting worse. I said, shut off the television, shut off the radio, and they improved because a chemical, cortisol, is increased. It drops the protective fractalkine so that inflammation can be produced at a higher level.
So how young, like, I guess, because if you grow up in these households and some of these kids grow up in difficult households, I'm a teacher, so I see it all the time. Like these kids, it's rough, right? How young do you see these things in?
Well, I only take care of 18 years and less, but I have often, especially after Joe Rogan or Mike Maller, or probably after with you, Blaine, there are going to be people contacting us and explaining they have a child who was part of an auto accident or was playing football or rugby or this, that, and the other, and developed a personality change after an insult. And that's inflammation that's causing it. I know because in the past I did help with individuals less than 18 years of age, and they got better. I mean, I got a lecture job because one of the heads of this company's son changed his personality from being a straight A student to being an F student, to being anti-drugs, to being on drugs, stealing, and so forth. And within 6 months of getting onto a protocol after testing him, he did much better.
Wow.
So we see it. And one of our products, which is being sold out, is called Brain Care 2, was a product that took 16 years to develop it for adults and then ended up producing it for children, because I kept on getting calls from soccer moms, football moms, rugby moms, jiu-jitsu moms, their children who have had trauma. And I don't take them as patients, but here is something that can be used to possibly help with, improving or protecting brain health through something called biological resiliency. Biological resiliency is the philosophy that, based upon our lifestyle, we can either enhance, improve our quality of health, or do things that are detrimental to our health, like drinking alcohol is detrimental to our health because it shuts off growth hormone in our brain and shuts off the growth hormone's ability to function in our liver by producing these 9 important proteins. Excessive sun exposure, smoking, high fatty acids, not good. Vitamin E, not good. Fish oil, not good. Nutrients in our, so diet and nutrients, very important. And the book that I handed to Joe Rogan, which is from retired Colonel Michael D. Lewis, When Brains Collide, is this incredible accumulation of his experience and the science behind fish oil, the EPA, DHA, or the omega-3s, or the eicosanoids is the family that it's in. And these have a very important effect. And the analogy I use is like putting on more Kevlar, more plates to protect you from your body being struck by any kind of projectile. It helps to minimize free radicals, oxidative stress, which is damaging to the brain, also to the quality of our skin. So nutrition, very important. And my daughter, Allison, is graduate from SDSU with honors in nutrition and food technology and applies her science in all our patients, not just civilians, but when I need help with our military, with gut-brain scenarios, leaky gut, gluten enteropathy with inflammation, and helps them to resolve that by addressing nutrition, by taking certain things out and putting certain things in.
So, well, I guess what would you recommend to people, like kind of whether it's vitamins, because I know like vitamin D is a big thing right now with COVID. Oh, yeah. What would you kind of recommend people? And I know kind of listening to Rogan, you kind of have to get tested and you got to kind of see the levels and everything. But I guess what would you kind of recommend for people? They should be taking this.
Right. Well, I usually don't recommend anything for anything specifically unless they're a patient under our auspices of what we do. Getting appropriate laboratory testing to look at your hormones, to look at vitamin D, to look at, if you're having gut problems, looking at the flora, the bacteria that's in the gut, looking at the leakage, or if there is leakage, looking for gluten sensitivity or allergies, celiac disease, different levels of celiac disease. Going on products which are micronized, which are from reputable companies that have good absorption, and we monitor the absorbability of our products. In fact, we find people with malabsorption issues who didn't know they had it or had no symptoms based upon how they absorb some of the products we give them. So if we give them a fat side, we'll take it after a meal and they don't get absorption, usually a telltale sign that something's going on in the gut. And then we fix that. So good gut health, taking good bacteria for the gut, vitamins, having a good array of vitamins, not trace amounts of vitamins, but therapeutic levels of vitamins or optimal levels of vitamins. Just having the name vitamin D in a multivitamin and it has 400 is meaningless. You heard on the program that I take a large quantity of vitamin D, and I don't have problems with calcium. You can see, it says right there, let's see if I get it there, 50,000 units.
Wow.
That's of vitamin D. See, vitamin D.
Right.
Okay.
Yeah.
So I'd love to promote this company, but, it's not my thing to do. It's a great product by this company. Okay. So good level of vitamin D. And as I said on prior shows, that vitamin D is toxic by its ability to absorb calcium, and the calcium too high causes nausea, vomiting, and can cause irregular heartbeat. And that needs to be looked at.
I've kind of seen some studies with vitamin D, and a lot of the people that had passed away from COVID or that were really struggling with COVID seem to mostly all be deficient in vitamin D. Is that kind of what you're seeing?
Well, I think it's a multitude of things. I think they're now starting to look at vitamin D levels, but other things they're not looking at, or maybe they're looking at, is zinc levels. Zinc on that video that Dr. John Saluth does from Johns Hopkins, which is on my website, the full one, and Joe put a segment of it up to view it. And it's very clear how zinc works to stop not only COVID, corona, influenza A, B, enterovirus, gut virus, and rhinovirus, nose virus, and H1N1, the swine flu, helps to decrease their ability to replicate in the cells. So in the world, according to the World Health Organization and National Institute of Health, or CDC, 1/3 of the world is deficient in zinc. 1/3 of the world, okay? And studies that are done, I was looking if there was a way to share the screen, but that's okay. I'll send it to you so you can see it. I have a graph from a great article looking at, and I spoke about it with Joe, looking at the level of vitamin D, the nanograms per deciliter of vitamin D, and less than 30, highest amount of COVID-related illness, 60, 30 to 60, less, and the highest amount of, or the greatest amount of resistance against COVID was when the level was greater than 60. In my population, based upon articles that show the safety and the beneficial effect of levels of vitamin D in the 80 to 100 is where I try to get my patient population. That's why we've only had 3 people in our patient population who have developed COVID. One was a 78-year-old who succumbed to the effect of COVID. He was 78, Alzheimer's, doing well with his treatment with Alzheimer's, and had lung problems. Paul, great guy. Used to have great conferences with him, and his wife, Martha, and Lauren, his daughter. And,
sorry to hear that.
2 other guys developed it because they weren't following the instructions. I sent out 3 newsletters. One of them was picked up nationally about how to use quercetin, zinc, vitamin D, if you want vitamin C, to help with protecting you from the virus getting a foothold in your body. If it gets in and can't replicate, it does no harm.
Right.
If it gets in and it has the ability to replicate, that's where it occurs. So I have a fireman who just contacted me on Tuesday. He said in his firehouse, everybody was COVID positive. He was the only one that wasn't COVID positive. Okay, he's been on our protocol for maybe 2 years, doing great, cognitively, mentally, physically, doing great. And he's the only one. He wears it like a badge of honor.
Yeah.
But the science is there to promote it. I'm just the messenger. The science that's been done is great. And I know from my population of patients that it's working because no one's getting it.
Right. And
my daughter was exposed to a positive guy for a couple of days, and she never developed it. He ended up in the hospital and then got out in 2 days, and it was perfectly normal in 5 days after. So it was probably about 10 days after he started with it. And no one asked him why he got better so well. Well, on a Wednesday before he started getting, looking at hospitalization, my daughter gave him the treatment of quercetin and zinc, and he took it. Wednesday, Thursday, Friday, hospitalized. Saturday, Sunday, discharged. So 5 days from when he started getting sick, he was good enough to be discharged from the hospital. And then 5 days later, he was back working. My daughter was in a small room with him, Rochelle. Never got it.
Oh.
She's been on the treatment prophylactically. 500 milligrams quercetin twice a day, plus 15 milligrams or 30 milligrams total of zinc. When you're in a protection, being proactive. If you're exposed to someone, you go to 1,000 twice a day. Right. So my wife works with people, and she's a doc too. People around her have gotten sick. Unfortunately, 2 have died around her, and she was exposed to them, and they're never had anything.
Yeah, and it's never, like that idea of just being proactive about your health. I think I was telling someone the other day, like it's so big, like it's kind of a wake up call. Like we have to be proactive about our health because this could happen again.
Correct. Well, unfortunately, the system in the United States is illness-based, which means that you don't go see a doctor until you get ill.
Right.
As opposed to being proactive, where you go to a doctor and you get checked out. You need to go to a doctor who does a holistic approach, someone who is in functional medicine, who looks beyond the superficial aspect of laboratory testing, which is what the problem is. You go to a doc, you feel great, you go in there and you get your laboratory testing, you get your EKG, you get your chest x-ray, you get, whatever it is, and the labs are just cursory. Think of the labs as being a 360-degree look at quality of health, and we only get a small sliver of that done in traditional medicine. I mean, we've opened up the amount of that angle that we look at, and the angle has components in it which look at other areas, so that you look at this larger subset of testing, but it has a reference on other areas of health so that we can determine on a broader scale how well you're doing, or else pick up other things that we need to test.
Right.
If you do a very limited thing, there's no way of knowing that you need to go look further. So we do sampling from different areas to get the signal, the red flag that, hey, you need to look at these things. That's why we haven't missed very much or anything really.
Right. So related to COVID, whether it's a mask, I know you guys kind of talked about this on Rogan a little bit. Have you seen like the shutdowns or the mask actually working or helping in these different areas?
Well, I read the literature that comes out.
Right.
I read the statements by different groups of thought about the benefits of the mask. The only thing I have to say is, with the level of lockdown that's been going on in California, one would expect that the number of cases would have dropped. It's the same thing with cholesterol and medication used for cholesterol. If the medication for reducing cholesterol really worked, we would see a drop in heart attack rates. We're not.
Right.
So it's something else that's going on. And for me, it's inflammation that's going on, because inflammation causes calcium to calcify on the arteries to create atherosclerosis or atheromas, blockage of the arteries.
Right. So
clotting.
I would imagine, have you seen like an increase since, I guess, the pandemic had started and locking down? Have you seen an increase with patients at all? Because we've talked about kind of the inflammation and the stress.
Have we been seeing more patients? No, our office is basically closed. Through remotely, we take care of our patient population. Our ability to do what we do here in the state of California, I have a license also in Florida and hopefully soon in another state. What we've been able to do is train other doctors in other states to provide our technology, and a lot of them are also doing remote or virtual medical. And there are companies that will go out to a patient's house and draw their blood, or else there are draw facilities that our patients can go to get their blood drawn, so they can get their blood drawn so we can then go and start the process of assessment and then the treatment.
Right. Because, I mean, in California, it's been difficult. I know I was on a phone call the other day with a doctor and kind of a conference call. So, and you're still practicing. You're in California right now. I know you had talked about you had moved to Texas.
Yeah, I'm in the process of scouting out Texas. I'm in the process of working on getting my license in Texas. So the reason for it is because I have a license in Florida. I have a license in California. California has 1.8 million veterans. Texas has 1.6 million veterans. Florida has 1.4 million veterans.
Wow.
So that's how I decided to get Florida license, and why Texas, for a multitude of great reasons, why I'd feel more comfortable in providing this technology to our veterans who are there in Texas.
Right. Because I know I was listening at the very beginning when Joe kind of asked you about why you're going to Texas, and I liked your answer.
Yeah, well, I could have said the real one, which I'll share with you. Their barbecue is phenomenal.
Yeah.
Their barbecue is phenomenal. When I was just there in Austin, we went for a couple extra days. I took my daughter, Allison, who is acquainted with Joe from being there on previous shows. There were two barbecue restaurants that we wanted to go to, Terry's Barbecue and Cooper's Barbecue. And they were just impressive, absolutely impressive. And I came from a Missouri-style barbecue family restaurant. I mean, my parents owned barbecue restaurants in California.
A lot different out there in Texas than in California.
Oh, yeah. It was Missouri-style, so they used hickory. It was really good.
Right.
And the reason why I ended up going into medicine when I was in cancer research is because my father died of multiple myeloma, bone cancer. So that's what was my turning point to do something.
And it's been Greg Abbott's kept it pretty open in Texas. I know he's done a great job, the governor in Texas, especially.
Abbott.
Abbott. Yeah.
I love him. I'm not gay, but I love him. I love his philosophy on our Constitution, the state of Texas Constitution, and the American Constitution. I love that, because I'm a great believer in the laws. And that's why I never had a ticket, do everything as best I can by the book and honor the laws that are there. Some of them are a little bit off on the deep end, especially here in California, but you have to respect them nonetheless.
Sure. Yeah. Yeah. So
it's respect. That's it.
Yeah. 100%. 100%. And, we still have to, sometimes I feel like we're kind of losing that a little bit in certain generations, but that's definitely key.
When you get frustrated to the point where things don't make sense, you give up the norms, the social norms.
Right.
What do you teach in? What area do you teach in?
So I teach middle school history. I'm in Central California, so just north of Bakersfield, south of Fresno.
Sure.
Yeah, right in the middle of Bakersfield, Fresno.
I read a lot of ancient history, classical history.
Right.
Augustine and
philosophy.
Dr. Green's book on Alexander the Great or Alexander of Macedonia.
Right.
Just reading the book that The Throne of Alexander, which is after he died.
Right.
And what happened to his entire kingdom. And how it went under strife and battle and so forth. Interesting.
Oh, it's incredible. Yeah, it's crazy. Just the history. Going back to Rome and, all the philosophy and all the philosophers. There's a lot there.
Yeah, that's the book Augustus.
Yeah.
Augustus was given to me by a guy by the name of Matthew Gosney, who was on the second Joe Rogan, which was number 574. He was the corpsman who was embedded in the Navy SEALs. He wasn't a Navy SEAL, he was a corpsman. He had a love for Augustus, and we would talk about it, and he sent me a book, so that's what I'm reading.
Nice.
Understand why he was supposedly heralded as being the best ruler, king.
Right. Right. Yeah. And I think, and it's so important even today, a lot of that philosophy, whether it's like Socrates, and it's still so relevant with our democracy, our constitution, and, set of laws. So you can still learn so much from that. And, it's helped create what we live in today. So definitely powerful.
What I've been hearing a lot of is et tu, Brutus. When Caesar was being knifed by his friends in the back. Yeah. And he turned, Brutus stabs him, and he says, et tu, Brutus, you too, Brutus.
Yeah.
It's what's going on a lot here nowadays. A lot of et tu, Brutus.
Yeah, I agree. And I seen that quote the other day. It's like, an eye for an eye will make the whole world blind. Who was that? I can't remember who said that, but I seen it, and it's like, yeah, that's so true. So true right now. So
I just hope things calm down and we can get to some semblance of life so we can move the ball forward.
Right.
Otherwise, we're going to be in the Stone Ages again.
Yeah, and there's a lot of loud people, and you tend to hear those voices, but there's also a lot of great people, and I see a lot of encouraging stuff going on, talking to people like you, and, there's a lot of young people doing great things. So it is encouraging to see this, and I think we're going to be okay, but we have to communicate. I think communication is so key right now, and we're losing a lot of that. But,
and not by this device.
Yeah, not by that. By having conversations.
Not by that device. I get people upset at me because they call me on the cell phone. My cell phone's on for maybe 4 hours a day. When I get to the office, it's off.
Right.
When I get home, it's generally off. So I only use it driving to and from the office, and then lunch break, coffee break.
Yeah.
That's it.
So I kind of wanted to back up a little bit, and you had talked about you had done some stuff with ESPN Outside the Lines programs, and I think that was in 2006 and 7, and you had worked with like boxers and NFL players. Was this before like all the stuff with CTE and everything came out, and like like the movie and all the whole big thing?
Yes.
Okay.
It was CTE, which is chronic traumatic encephalopathy, is the pathological, which means that when you take tissue samples and you look at it, there's a pattern of destruction to the tissue, which is being seen by a Dr. Daniel Pearl at Bethesda, Maryland, at the hospital there in his research. Brilliant guy. I had the honor of being at this meeting in England and had a chance to meet with him and complain that I had tried for 8 years to get in contact with him. And there we are in the same room having dinner together and speaking to the same.
Always tends to work like that.
Yeah, just took it. And he said, 8 years? I said, yeah. No one listened to me because I don't have credentials like the Harvard, Yale, and all that. So no one looks at me for that. Look at the work that we've produced. But anyway, CTE is in the work that Dr. Pearl did in 20,000 brain sections, I think it is. He found in every single one of these military individuals who had died with a diagnosis of PTSD, he found structural, physical damage to the brain. And when I read this article he had written where he made this brilliant statement, how can you call a psychiatric illness when you have physical findings?
Right.
It's like having someone who's shot through the heart and you're saying they have depression.
Yeah.
So there are physical findings that Dr. Daniel Pearl has found, and Dr. Melu, Dr. Bennett Malou, who's up in Lodi, California.
Oh, really?
Who, started this thing on CTE.
Oh, that's right. The movie. I remember seeing them. Yeah.
The movie, Concussion.
Concussion,
correct.
yeah.
And I've spoken with him a couple of times. I wanted him to be in the movie, Andrew Marr's movie, but he was already in a product making movies with someone else, so he couldn't cross the line. But he was brilliant in bringing it to the forefront. He got a lot of flack for it because the American pastime is football.
Right.
And you don't want to tarnish it, but you don't want the effects to be ignored of having played. And I think there should be a disclaimer that says that, I understand playing football might lead to early onset of Alzheimer's, dementia, punch drunk, depression, anxiety, bipolar, and so forth and so on, which is what has been shown to be derived from people playing football and boxing, punch drunk syndrome, which is a Parkinson's-like illness. But there's really, I get asked a lot, is there something you can do to protect the guys with, playing football? Rule 48, I think, no lateral impact, wearing these specially designed helmets, which I really don't believe help that much because the surface of the head, the scalp and so forth is protected. But we have to understand that the brain is sitting in fluid and it moves according to the movement of the head. And if you are wearing a helmet, it doesn't stop the movement of the head. The damage is to the outside, so you don't get a fracture of the skull or you don't get a bleeding of the head from impact where you lacerate the scalp. So you don't get those superficial things, but it's the internal floating of the brain in that fluid that is the problem. Rotational force, side by side, getting the temporal parietal lobes or occipital lobe for visual cortex in the back, or the decision-making in the anterior lobes of the brain, the frontal lobe, which is the most damaged, the frontal and the occipital in the back. So a helmet only keeps everything on the outside protected, does nothing for protecting the inside. So what do? You make sure that the biological resiliency is higher with the omegas, the eicosanoids, the tocopherols, the vitamin D, minimizing alcohol, minimizing anything that will add to inflammation, glutens, low inflammatory diet. Those are the positive things that can be done.
I don't know if there's any studies on this. I know it had kind of been talked about, like adding like more pads and adding like better helmets. Sometimes that's going to even create maybe more because the people are going to basically, run harder or hit harder and stuff. But if you go back in the day, sometimes like they would with like leather helmets, it might not be, but what do you think about that?
Well, the analogy, because the helmets I really don't believe in, it's something. It's the best we have, so use it, okay? It's like a guy who gets shot wearing Kevlar, he still has pain on the inside.
Right.
The bullet hasn't penetrated to cause a penetrating wound, but the impact of the energy that's transferred from the bullets being stopped by the Kevlar, the energy, conservation of energy theory in physics, is passed to the inside. Same thing with what happens in the head. The energy is passed to the inside and creates a problem. So going back to your leather helmets and then the earlier style of suspension helmets where the head is suspended in between with padding and bands and so forth, and then now with the the thicker plastic, they're all the same.
Right.
They're all the same. The only thing that's going to change between the past, the 1930s, 40s, 50s to now, is that the superficial injuries will be less. You won't see the fractures. You won't see the broken zygomatic arch on the face because it's protected. You won't see the nose fractures. But the force, the energy is still transferred from the outside to the inside. And that's what needs to be protected. And we can't protect it by putting a helmet on the brain.
Right.
Or putting stuffing, putting packing material to protect it. It's glass, it's shatterable.
Sure, yeah. And I think you made a great point. Like, you have those big traumatic injuries, whether it's a veteran, in a IED accident or something like that. But you also have those football players that are just taking hits, boxers, hit after hit after hit. And it doesn't seem like a lot at the time, but it builds up over time. And I think you had kind of talked a little bit about that.
Yeah, well, there's an accumulation of insults. And according to a few articles out there, they've been able to look 17 plus years after the initial injury and still find elevation of those inflammatory cytokines. Those are the inflammatory markers. So if you have an injury at time zero, and as you're walking forward, you can pick up that the inflammatory processes or a process is going on. And it's over a period of time that inflammation, like acid thrown on your skin, is eventually going to leach its way to the bone.
Right.
So you'll destroy layer after layer of the white matter, gray matter in the brain, or the gray matter, white matter. Okay. Right. And that's also another issue where the density of the gray matter, which is the bodies of the neurons, and the white, which is the axons, is that there's a difference in density. So when you have force put to the side or front, there's a movement of the gray tissue because it's heavier. It moves stronger than the lighter, moves slower, and shearing occurs. And in shearing, what happens is you tear the axons. And in tearing those axons, it releases chemistry, which induces inflammation.
Right.
So that's where you get the inflammation that can last long.
And that's kind of listening to you right now talk, and even on the Rogan show, like just that idea of inflammation having such a big impact. It's kind of changed my whole thought process when thinking about mood disorders or, people struggling with being bipolar, things like that. So it's really opened my mind, and I hope it's other people's mind that listen to this.
I think I have 4 articles within that compendium of 30 that talk specifically about trauma eliciting the inflammation that is measurable by the cytokine markers, the interleukin 1, 1 beta, 6, tumor necrosis factor alpha. And when you have those elevated, it tells us that's inflammation. That's damage. Right. That's the acid on the open wound. That's salt in the open wound.
Yeah. So as we kind of go forward, I want you to kind of talk about some, I think you've written a couple different books. Do you want to kind of talk about those different books? And I know you've written, hundreds and hundreds and hundreds of articles, but the book specifically, do you go ahead and talk about those real quick?
Yeah, the first book, I was in the area called anti-aging medicine. And I know that anti-aging medicine is a term that the general populace know, but I was working in a very academic environment at that time, dealing with UCLA, USC, and in hospitals. And when I shared with them back in 95 that I was looking into anti-aging medicine, they'd look at me and said, "Gordon, what's wrong with you? You used to be a good doc. Now you're doing this craziness." But I looked for, something that made sense. And I coined the term interventional endocrinology, which is the title of my first book from 2007. It took about 5 years to write, or 7 years to write the book. And it was based on an incredible compendium of articles that I read talking about the science behind each one of the hormones that we use. And that's why the book did so well, is because it took a lot of people who didn't really know about the hormones and gave them the science. It wasn't based on one article. It's based on, 1,200, 1,400 different articles that spoke about different things. And chapter 5 in that book was my first attempt at putting together hormone disruption due to trauma, chapter 5. The other ones talked about testosterone, estrogen, progesterone, growth hormone, and the benefits based on the science. And I refuted the cancer mythology with growth hormone and with testosterone based upon what science exists there already. And, I won't go into detail about it, but having Abraham Morgenthaler from Harvard, who's now at the University of Boston, who coined the term low T syndrome, who wrote a book called Testosterone for Life, which is a great book. In it, he talks about the benefits of testosterone and refutes a lot of the mythology that's out there about prostate cancer or about heart disease and stuff and things like that. And when used appropriately, testosterone is phenomenal. Also, growth hormone. There are articles which I talk about growth hormone and helping with Alzheimer's, with wound healing. There was an article that I believe I spoke about on his show, which of all places came from University of Birmingham, England, after I had been abused about, growth hormone doesn't serve any purpose. And it actually found that in people who had treatment-resistant depression or atypical depression, meaning they were depressed and they were put on antidepressants and they didn't get better. They were resistant. Well, in this study, they found that 61% of those people had growth hormone deficiency. And when they replenished the growth hormone, they got better.
Well, so there is a lot of benefits in it then. And
a lot of benefits to growth hormone. And one of the first products that I developed back in the late 90s, early 2000s is a product called secretropin. And secretropin is a natural growth hormone stimulator that increases your own production of growth hormone. It doesn't replace your growth hormone. It helps on 5 pathways in the brain to upregulate your production of it at nighttime, which is when the bulk of it is made between 8 at night and 4 in the morning. So secretropin and dinotropin's at the website. And my young daughters, are using it. They're in their 30s, all 3 of them. And they're using it and telling me, about sleeping better, this, that, and the other. I just know from our studies from 2001 to 2006 that it raises growth hormone level, okay? And in 2006, the product went to doctors only. Why? Doctors have the opportunity to check the blood levels and show before and after, and that it works. So, and then in 2015, I think it was, for a project, we did a direct-to-consumer product called dinotropin, which is on our website, which I'll tell you later. And patients are using it, and I get feedback on it because I always want to assure that anything that we've developed over the years is living up to its function. I can't say that it'll help them with X, Y, and Z. All I can say is it raises growth hormone levels.
Sure.
And in raising growth hormone levels, whatever the benefit is for you, that's your benefit. I don't know what it's going to do. All I know is what it's supposed to do and raise growth hormone. And we have a new paper going out, I'll send you a copy of it, which talks about the articles that are out there that show when you raise growth hormone, this is their research, what they found. This is their research with this event or this illness or this condition or this, that, and the other. And I don't have to make claims, which I'm not allowed to make claims, state that this product will treat this, that, or the other. That's not what I do. I do the science that shows that it increases growth hormone, and the science out there already exists showing that what growth hormone benefits.
Right.
I follow the rules.
Right. And like with testosterone, I know you guys had kind of talked about, I think it was the military had stopped kind of giving testosterone, even though they kind of knew it was helping.
Well, yeah, that was in 2014 when the insurance for veterans decided under, I believe, recommendation by the active military or by the military not to dispense testosterone because they were concerned that it was causing guys to be too aggressive, to be too agitated. And at that time when they were going out 2014, you look at what was going on in Afghanistan, Iraq, and so forth, you didn't want them to be hair-triggered or to be, off on their game.
Right.
So I understood it, and that's what led to our 3-year study on Clomid in veterans less than 40. What we did was we figured out a pattern of use of Clomid that was the least amount of Clomid, and the pattern of dosing it every third day, and 50 milligrams or 25 milligrams every third day, which worked the best to achieve a documentable objective improvement in their level, and concurrent with that, improvement in their level of testosterone and improvement in their psychological cognitive ability. On each person, I've got tons of data that just needs to be put together and made into an article, but I'm spending my time in hands-on direct patient care. So it makes it difficult to me to do it. I'm writing 3 papers right now, one on Clomid and another one on the TriPack, and then another one on neuroinflammation and how it disrupts the biochemistry of the brain, because that's something that needs to be put together. And there are probably more brilliant doctors out there who focus on research who are already doing that, which I hope they do it rapidly. A lot of things that we instituted back in 2004 saw in our treatment. We're now seeing articles being written about it and has nothing to do with what we did. They're just catching up with what we've done.
Right.
And, since 2004, I've spoken about in multitude of arenas, talked about it to the military, to the organizations that I belong to, 3 or 4 of them go out and I speak. I train through one of them called AMMG, Age Management Medical Group, twice a year. give classes. Doctors who have seen this podcast with Rogan and will see yours will be interested in possibly getting trained, because we need another 500 doctors to be trained.
We're getting that kind of that workforce out there, and the multitude of numbers is so important, I think. And that's what it sounds like you guys have done and been able to accomplish, and continuing to try to build more that network.
Right. Once we get the network out there and we're able to care for more people in states where I can't treat, it'll be good, because their improvement will be, they'll become a mouthpiece or a spokesperson for what we've done and what has helped them. I mean, I'll send you a document that was sent to me by Dr. James Zender of Psychology Today. He's a psychologist in Wisconsin. No, it's either Michigan or Minnesota. I think it's Michigan. And he's written a book he is heavily into PTSD. He came to our class. He learned about what we're doing. He promotes what we're doing within what he's doing. And when he did a blog on us, he had a lot of our patients going to his blog, reading it, and putting in testimonials that they didn't give me. I don't go chasing for testimonials because I'm uncomfortable using what a patient says to try and encourage some other patient to come in and be a patient.
Sure.
I don't run that way. It's not my old school kind of mindset.
Right.
I think if they look at the science that is out there, and they look at the science we deliver, they'll make their decision that this is something that they want to take a chance on, a leap of faith, as opposed to reading about a couple of hundred guys who have done very well, more than a couple hundred who have done very well. I don't want to use leverage. I want people to make their own decision based upon reading.
Right. And everyone's different. Everyone's bodies and minds are different,
Right.
And they all work a little different than the next guy. So I wish more people would operate like you do. And I think our world would be a lot better place sometimes.
I try to be realistic and not want to influence anyone into making a decision based upon me saying, hey, this stuff is really good. It works. Everybody's got to be on it.
Right.
Well, that might be what I feel, but it's not what I'm going to say.
Sure.
I've seen things. I've sat at my desk in my office receiving what we do as an MPQ, which is a monthly program questionnaire, where patients fill out on a 30-day basis how they've done. And when I get these incredible MPQs, I mean, it's kind of difficult not to get a little emotional about seeing someone who lost their parenthood, lost their marital status, or lost their friends and lost their job and everything. And now they're bounced back because now they're able to deal with it.
Right.
And getting emails like that their quality of life has been returned to where it was before their injuries. And they're able to function and fend for themselves without medication or with minor amount of medication. That's really the goal. My goal was, and Andrew Marr's goal is to stop the suicides and get these people back into full functioning, not partial, full functioning.
It's incredible work you continue to do. And I don't want to talk too much about his project. I know the film that Andrew and you were a part of. Would you briefly kind of talk about that?
Yeah, I'll be brief. I didn't even want to be in the movie because I didn't want it to be a testimonial or a promotional kind of deal. So I have a very small amount of exposure there, which is good. The real issue were the 10 individuals, the 10 cases that were presented. They're not all my cases. I think 6 of them were my cases. The other 4 were from other quality medical centers. And they told their own story. I didn't need to say anything.
Right.
They told their own story of where they came from, what happened to them, how their life had changed, how traditional, conventional medical wisdom played into their care, and how well they did on that modality or paradigm. And then coming into our program or one of the other of my colleagues' programs, and how they improved to the point where they're back in the game of life and doing well. And there were some notable football players in the movie, as you know, and surfers and gymnasts and special forces and Andrew Marr.
Right.
So it was based on his book, which I recommend people go to Amazon and either download it as a digital or to buy it inexpensively. Tales from the Blast Factory. I got my copy up there. Tales from the Blast Factory, which is his story of not only what happened to him, but about how he took what happened to him and how it changed his life to allow him to look at not his own problem, but all his brothers and sisters' problem and look at helping them. And in the act of looking to help them, he would help himself. And that's what led him to me. The same time I was looking for him, I was looking for a 501(c) charitable organization, which was owned and operated by military, either veterans or active. And he was looking for some crazy doc out of the box. So
Right.
we met in the cloud and phone call and so forth. And he came right up and started his healing process. And we've been, I'll say, linked at the hip ever since because our philosophies are very similar. Our modalities might be a little bit different, but our goal points are in sync, absolutely in sync.
Both very humble. Yeah. So are there any other projects you're working on that you kind of want to tell our listeners, or anything you're kind of working towards or want to tell them?
Well, the project that we're working on is how to minimize the expense for what we do, how to minimize insurance costs, minimize laboratory costs by doing 3 projects right now. We finished one last year, so it's 4 projects, 2019, May of 2019, we started one with Army medics. Now we're doing Marines. We've got a SEAL team, and we've got another special ops group that we're setting up to take our core treatment, which is the tri-kit, which is the 3 products, CME, Clear Mind, and Energy, and I'll send you some, and things like pregnenolone, DHEA, and so forth, vitamin D. And using these without doing any laboratory testing and seeing how well people do. We're just doing this. So we had 50 to 70% improvement with the medics that we started with in 2019. With the Marines, we've got about 42% improvement after 30 days, just waiting for the 90-day period. And so it can be readily available without needing to see a doctor at the inception. If you do 50% or better, you're good. Continue. If you don't do 50% or better, then going and getting laboratory testing done to find out what it is we're missing.
Right.
That's the project that we're building into doing now. We started the Marine project in December, okay? In the end of this month, hopefully we'll start the SEALs, and then next month we'll start with the Special Forces.
Awesome. That's incredible.
And that's one. That's probably the entire group of projects. And before, one of the products, Brain Care 2, which has been difficult to keep in stock because it's doing so well, that one took 16 years of work to get it to market after we did clinical assessment. We take the composition. How we derive the composition is we use it as a powder form in the practice, and we find out which works the best. And then we convert it into a nanoliposomal or liposomal product, which is a liquid that gets absorbed very rapidly, so you can use less, so the cost goes down. There's one of the components, PQQ, which is thousands of dollars per kilo, which would make the product very difficult as a capsule, very expensive. So by using nanoliposomal, you can get improvement in the absorption, so you need less to get more. It's like vitamin C. You know how much vitamin C you absorb when you take 1,000 milligrams by mouth?
I don't know. How much?
About 19%.
Wow.
So 190 milligrams out of the 1,000 is absorbed. And when you mix it with liposomal, you absorb about 94 to 97%. So that means you can actually use 4 to 5 times less to get the same absorption. So if we only need 20 milligrams of PQQ to be absorbed, we can either give you 100 milligrams, to get the 20 absorbed, or we can give it nanoliposomal with 25 milligrams and still get 95% absorption. So it's a quarter the cost.
Right.
Okay. So you're reducing the cost. So that's what we developed. We started this with secretropin, dinotropin back in 2001 and have monitored, and I have a brilliant PhD who specializes in nanoliposomal. He's from Israel and does a phenomenal job. He's took our formulation and formulated it into our 3 products. Clear Mind and Energy is the one that just gives you clarity and brain energy, so you don't have to use coffee, Red Bull, 5 hours energy, methamphetamine, dexamphetamine, Adderall, Provigil, Nuvigil, cocaine hydrochloride, snorting caffeine. You don't need any of that. So, and it worked well. My older daughter, who was in her residency, was one of our testers of it, and the whole hospital staff was on it. You just crystal clear. There's no caffeine added to it.
That hospital was at a high capacity at that time.
This was 8 years ago. I think it was 8 years ago when we started. We only released it 2017, but 8 years ago is when we started building it. And 2004 is when we started building the Brain Care 2. And then 2015 was when we started building the B is for Brain, which has totally blown us out of the water. Absolutely blown it. It's accelerated healing in our blast trauma, head trauma cases. But people ask, can anybody use it? Yeah, anybody can use it because it's all natural, has 6 special B vitamins, but the delivery of the B vitamins is key.
Right.
And PQQ and CoQ10 are incredible at increasing the energy production in the brain.
And like how much you absorb, how much it absorbs. Where can people find this at?
This is at www.millennium, spelled MILLENNIUM, healthstore.com. And the proceeds from our sales help us with our studies with our veterans. It helps us to provide funding for our active and veteran community, as well as in our fire department and law enforcement. It helps us with our research studies and also to regenerate the purchase of it. That's where those funds go. And right now from Joe Rogan show, it helped us to meet a budget need so that we can take on more veterans and also do those 2 studies that were put on hold with the SEALs and with the Special Ops group.
Right.
So, which is great.
I'll definitely put all those links in the description. I don't think we'll hit anything Joe Rogan, how he helped, but we'll do what we can as well.
It's getting the word out.
Yeah, definitely. So, one at a time.
Joe Rogan gets the word out for us. You get the word out. Mike Mallard gets it out. Dave Asprey, when we did Dave Asprey, got the word out. I still see people referred in from him. All the people. I just did in England a military program podcast talking about what we did in January in 2020 in England and what we're hoping to do in 2021 once COVID gets under control and, to get the information out there. And I'm looking for, organizations who want to be trained, who want to take our technology. And I shared with Joe about the software package, my background from 1968 until present in computer programming and so forth. Wrote a program over the past 4 years with the help of a brilliant programmer, Samuel Nee, who built the interface. I built the engine that does all the analytics, and he put it into a format and interface to make it simple. So what it does is it accelerates anyone's ability to do what we do. We need 500 doctors. So this is a tool that allow them to accelerate their ability to do wellness medicine with hormones, HRT, hormone replacement, testosterone replacement, anti-aging, age management, and traumatic brain injury. And my daughter, as I said, it took 18 months to get her proficient at what she's doing. The program does it in 15 minutes.
Wow.
So it's a big difference.
Yeah, that's a big gap.
Yeah, well, the point is it's an educational program. We don't sell it or promote it as a diagnostic program. It's an educational for the doctor. If the doctor is confident and comfortable with the results that it projects, they sign off on it, accepting responsibility. Otherwise, it's just a tool to help the doctor in their process of interpreting the laboratory results. So I give out free trial licenses. So from Joe's show, we got like 14 docs who are waiting to get their trial license, which will probably be given out in another week.
Nice. Awesome. That's incredible. And again, I just want to thank you for coming on again. And where can our listeners find you, or to contact you and get a hold of you, or if someone needs help and they're looking for that kind of help, where can they reach you at?
Well, because of the load that we have at present, we're not accepting phone calls or emails directly to us, because for every phone call or email, it takes 15 minutes, if not more, away from our treatment of our present patients. And my daughter and I are the only two here in the state of California. We have some docs elsewise, and they can go to TBI Help Now to the team and find doctors in their state. If they want to contact me directly, they can go to tbimedlegal.com, tbimedlegal.com, and fill out an enrollment request. If they fill out an enrollment request, within a few days, a packet of information will be sent to them, which has been generated, built upon over the past 20 years to answer questions about what we do, how we do it, about what benefits, the different forms of treatment, psychiatric related issues, trauma, football, so forth and so on, and things they can take to their own doctor and ask their own doctor to help if they'd like.
Awesome. Well, thank you so much. And I appreciate you coming on and all the great work you're doing. Humble and just a team with you and Andrew, all the great work you guys are doing. So I appreciate it. And hopefully, I'll be able to get at least some word out. And I know Joe Rogan, just being on his show, you got all kinds of inquiries, I'm sure. And that really helped a lot as well.
Well, the sharing of the information is going to be very helpful. You'll be surprised.
Right.
There are people in your enclave that might not listen to Rogan that, will see it for the first time and then possibly go over and watch the Rogan.
Absolutely.
But you're the messenger. You're the provider of our information. I thank you very much for allowing me this opportunity to share with you.
I appreciate it.
Blaine.
Thank you.
If you are looking for firearm training and safety courses, make sure to contact Jeffries Firearm Training. Anywhere from intro and basic courses for men and women to classes for the most advanced firearm experts, Ronnie Jeffries will take care of all your needs. Make sure to contact Jeffries Firearm Training on Instagram at Jeffries Firearm Training or through email jeffriesfirearmtraining@gmail.com.
Thank you for listening to the Freedom First podcast. Please subscribe and give us your honest rating on Apple Podcasts and Spotify. Let freedom ring.